Hello and welcome to the latest in the series of the Own, Learn, Thrive LinkedIn Lives. And if you're watching us now, do let us know. I can see, Kath, that you're there. You are in the right place. And anyone else who's watching live, please say hi in the comments so that we know you're there. And feel free to ask any questions or add any comments yourself as we go along. So with me today, I have Ros Wright, and Ros is a clinical communications specialist. She has 20 years of experience, and she trains overseas healthcare professionals who've been recruited to work for the NHS. She's also co-written several course books, including Good Practice, which is an award-winning title, being President of TESOL France, a Trustee of IATEFL, a General Secretary of EALTHY, if that's pronounced correctly.
That's right.
And she's now running a specialised teacher training programme for teachers who are making the move into English for healthcare professionals, how to teach clinical communication skills. So, Ros, I've just given a kind of potted history, but what I'm really interested perhaps to start off with is if you could tell us a bit about how you got into teaching English for healthcare, because I think this is a relatively new field in a big way, but you've been doing it for ages. So, tell us a little bit about that.
I have, but as with a lot of things in ELT and particularly in ESP, I fell into it. So I was working at the time for Kaplan in Paris, and we used to run courses for doctors wishing to go and work in the States. And there was an English language component to that exam, or there still is, and the person who was teaching it suddenly had to leave Paris, and so they wanted somebody to to take over, and so I did, and so armed with one book that was about that thick and had some fairly gory pictures inside, which I now can't look at even today. It was down to me to deliver that training, and I enjoyed it so much. I couldn't get enough of it. And when I went to do my master's, there was somebody else on the program who was interested in English for medicine and became one of my co-authors, Mari McCulloch, and it sort of developed from there. We wrote a book that you mentioned in the introduction, and then I can't say it mushroomed because it was a bit of a slow burner. I was lucky in that I was in the right place at the right time, sort of early 2000s, writing course books in ESP. There was a bunch of us who, sort of did that in different sectors, and it went from there. And I really, really got a kick out of doing it, and I still do now. And I started that in '98. Yeah.
So what's the kick that you get out of it then? What specifically appeals to you about it?
Well, I think it's fascinating. Communication with patients is sort of, so that's clinical communications, if you like, is sort of like, how can you say, like supersized soft skills. So, we talk about soft skills today, but I've been teaching soft skills, I can't even say it. I would if I could say it. Since '98, in fact, without sort of realizing it until much later on, and you're sort of, it might sound a bit cheesy, but you're kind of giving back as well at the same time, because you're helping train people who are then going to sort of take care of your granny or your mum or whatever, it sounds a bit cheesy, but actually it's one of those areas that is really fulfilling. You could send me into a finance class or an engineering class, and I'd be like, yeah, I'd do it, but I wouldn't get a kick out of it.
Yeah, so there's a real kind of making a difference kind of feeling about it.
Yeah. No, and also for your students as well, because for a lot of them, this is sort of life-changing, especially those people coming to work in the UK, or the people that I work with, or sort of working in another English speaking environment, this can be, quite life-changing. So, yeah.
No, thank you. So hello to everybody who said hi in the comments. And I'd be really interested to know, actually, those people who are watching, are you already involved in medical English, or is it something that you're interested in getting into? So let us know in the comments, because that would be fascinating, I think, to see, because it is a growing field, isn't it? And I think more and more people are kind of getting involved in this. So can you tell us a little bit about that? Why and how is it growing for us?
Well, one of the reasons it's growing is the need for healthcare providers in the UK, in Australia, in the US, and people need to sort of prove their level of English before they can register with the various healthcare boards. And in order to do that, you have to pass OET, which is called Occupational English Test. Now, why Occupational English Test? I don't know exactly. It could have had a more healthcare orientated name, but but it is actually specifically for healthcare providers. And talk a little bit more about that if you like, but it's since that test has been recognised, particularly in the UK and Ireland, although it has been in existence since the 1980s, it was developed in Australia. Since that became, as I say, accepted form of proof of your proficiency in English, the numbers have been growing, as I say, particularly in the UK and Ireland, where more and more language schools are offering OET prep as part of their suite of exam preparation courses, and not just private language schools. You can be training OET through sort of further education establishments in the UK, even university. Some universities run OET training courses as well. So it's that has seen the demand grow enormously. I knew about the OET sort of quite a while ago, and was sort of singing its praises for a long while, because up until very recently, the exam necessary to prove your proficiency was always the IELTS. Sorry, there's a fly in my room. And so this has been the game changer, and it's been the game changer for all of us working already in English for healthcare, because of course then the publishers get involved and they say, okay, well, we need a course book, or we need some self-study books or practice tests, and so those people that I work with in editing have also, I work with a couple of editors who have become sort of specialised in that area. Because there is now that need, and it's one of the areas of ESP that continues to grow slowly, but surely, if you like. Whereas other areas in ESP haven't grown to that extent. Really.
Well, and there's clearly, I've written books for IELTS in the past and been an IELTS examiner, and it clearly was not really a great fit, I would say, for these professionals. That I know there are things in OET that are very specifically related to kind of how you communicate with patients and so on, that just wouldn't be covered under IELTS at all.
No. I mean, talking about, sort of the history of, environmental issues or raising the Titanic or something is really not that critical to the people that we work with. And the people that we work with need to be functional from day one. So you throw them into the wards, they have to be able to communicate effectively with their patients and with their colleagues as well, obviously. But, the IELTS is not going to prepare them for delivering bad news, for example, for reassuring a patient, for explaining, terms and conditions and treatments and those sorts of things. And the OET goes a long way. I wouldn't say it's perfect, but goes a long way towards doing that.
Yeah. No, absolutely. I see in the comments that Marcia, well, Kath, I already know is involved heavily with OET, and Marcia, you are as well. Yes, so doing OET preparation for healthcare professionals based in Porto, and recruiting for the NHS. Interesting. So yes, there's a lot going on. So Ros, you talked about how you got into teaching medical English. So presumably you don't have a medical or nursing background. Shock horror. So do you think this is important, or do you think it's an advantage, or are there other skills that are more important?
Well, I can't say that it's, hi Jill, hi. I can't say that it's not important. I mean, if you do have that background, absolutely fabulous. There are a couple of my colleagues. Virginia Allen is possibly the most well known of them, who does have a nursing background and continues to do some nursing even today. And she's also an excellent coursebook writer as well. So, there is, yes, I can't say that, but what I can say is you don't have to be able to, you don't have to have a medical background in order to teach. Most people teaching medical English do not have a nursing or a medical background. So I think, most people can sort of breathe a sigh of relief if they are interested, but feeling a little bit, sort of, are they out of their depth kind of thing? And, and that's something that I do on my course. The first module in the course is making that move from general business, if you like, into, medical English. How, is it really necessary to be able to, sort of explain all the prefixes and suffixes that you could possibly find in medical terminology? No, it's not. Because after all, one of the main things about clinical communication skills is being able to explain things in what I call patient-friendly language. So, a lot of my doctors will try and explain, the ins and outs of my sciatica with all the technical terminology that I just draw a blank at, even to this day. So no, you don't. I mean, at the end of the day, clinical communications, as I said earlier, is soft skills at the end of the day. And that's what we're all about in English language teaching, really, especially when we're talking about professional English. And clinical communications are an enhanced version of that. And it sort of stems from the idea of, back in the day, patient care was very much doctor-centered. And it was all about, sort of them telling us what was wrong with us and how it was going to be dealt. And we didn't have a voice. Whereas clinical communications is about enabling, at the end of the day, it's sort of about enabling the patient's voice, if you like, and ensuring that a patient-centered approach, or what we call today a person-centered approach, is facilitated at every opportunity. Assuming that a patient wants that. Of course, some patients prefer, possibly, tends to be an older generation, prefer, what the doctor says is God, and we don't challenge it. But most people today in the English-speaking world, at least, are looking to be more involved in their care, to have a say, to take joint decisions with the healthcare provider. And clinical communications is about enabling that. So it's initially obviously about building rapport, using active listening skills, demonstrating empathy and reassurance, involving the patient, and then of course, obviously explaining things in a way that they are going to understand. So it's, there's a lot of evidence to say that you can learn this, because, back in the day they would say, oh, well, it's only nurses that need to do that because they're the only ones that talk to patients, but
at patients, yeah.
At patients, exactly. Yes. And one of the quotes I always give, and anybody who knows me has probably heard it already, is by a physician from the 1800s who was way ahead of his game. And his name was William Osler. And he's possibly the most quoted medic in history. And one of his famous ones is: the good physician treats the disease, the great physician treats the patient who has the disease. And that's the sort of, it sort of encapsulates, if you like, the idea, the concept behind patient-centered approach and clinical communication skills, and sort of the result of effective patient so clinical communications, if you like, is that the patient is more likely to adhere to the treatment. They're going to make a more rapid recovery, and these sorts of things. And also, what the hospitals and trusts are all about is ensuring patient safety. So obviously, if you communicate the information in a way that the patient can understand, there's less likelihood for sort of patient error in terms of taking medication and understanding what is involved in their treatment and care, etc. So
that's fascinating. I mean, I was first diagnosed with an autoimmune kidney disease like 20-something years ago, and so I've been going to hospital. It's fine, it's in remission, but I have to go to hospital regularly, and I've really seen a massive shift over that time in terms of the way that I'm treated and involved and that kind of thing. So it is interesting.
Well, you would have done. Yeah.
Sorry, go on.
No, I say you would have done.
Yeah.
I had an experience the other day where I went to see my GP. My GP told me I was intelligent. I thought, okay, well, that's fine. Thank you very much. And then afterwards, I went to see a consultant, and the consultant said several times during the consultation that I was intelligent. The GP was a native speaker. The consultant was a non-native speaker, but they all kept telling me I was intelligent, and I'm thinking, how patronizing is that? It's like, it's not that it's not the fact that I'm intelligent. It's the fact that as a patient, I have a right to know the information. Yeah. And to have as much information at my fingertips as possible. Their sort of view was, oh, well, you're asking all these questions because you're intelligent. It's like, no, it's my right.
Yeah, and your body and your health, etc. Exactly. Interesting. So, I mean, do you think there's a cultural element there as well? Because you mentioned like Western Europe. So, presumably there are cultures where there is more of a top-down approach generally.
There is, yes, there is. And I say, even within our own culture, some people, it tends to be a generational thing, but I can't, it's not unfair to generalize totally, but that sort of tends to be. But the reason why, one of the reasons why OET is so important is that it tries to replicate the sorts of scenarios that candidates will have in the workplace. And, being able to deliver a patient-centered approach to the care that they provide is tested in OET, because it is part and parcel of what is of the care that's provided here and in the States and Australia, etc. So I teach a lot of doctors from India. And the younger ones tend to have a more of an idea about patient-centered. The patient-centered approach than the older ones. So anyone sort of, let's say 40 and above, they're less likely to have studied anything like that in their own training. Whereas the younger ones might have done, but it might only have been, a presentation on, a lecture on, the
rather than being central.
Exactly. Yeah. So even, with the course that I run, even the younger ones will say, oh, that, I've really got a lot out of it. Thank you. They've sort of, understood a little bit more about about patient culture, if you like, in the hospital setting that they're going to be working in. And that's really important. That's really key.
Fascinating. So you mentioned a little while back about the program that you've created, the sort of how to teach clinical communication skills. Can you tell us a little bit more about that in case anybody listening might be interested in doing it with you?
Yeah. So, we all know that, you know, if people have done a CELTA and even a Delta, it's very much orientated around teaching probably young adults at the end of the day, or at least, you know, sort of adults in general English. And there's very little training, teacher training, that is specialised. And I do think that this is an area that is severely lacking, not just in my field, but in any field, really. There are a few courses for general business English, and I'm sure in those, you know, people can learn about, you know, will learn about teaching soft skills, etc. But there's a lot more to it when it comes to healthcare. And so the course that I teach is called How to Teach Clinical Communication Skills, which is a bit long, and I apologize, but it sort of hopefully does what it says on the tin. And it's sort of divided into 3 sections. So the first section, to say it's a 6-week hybrid course, with video input, but also some face-to-face sessions as well. And it starts by looking at clinical communications skills. And so the first 2 weeks are dedicated solely to that, and developing an understanding of those skills and the rationale behind them. And they go from sort of learning in general about the patient-centered approach to things like negotiating treatment, gathering information, delivering bad news, that kind of thing. And then in the middle of the course, there's a section as a sort of an introduction to OET. So for those people who are not aware of OET, so we do 1 week looking at OET. It is not a full preparation on how to prepare students for OET, however. So the OET board have their own preparation for that, and I would strongly advise people to do that. But what it doesn't have, I think, is really, it doesn't really give people a grounding in clinical communication skills, and that's what the first part of my course would do. And then the final part, so the third part of the course, is really about materials design, materials development, but specifically in the area of developing materials for clinical communication skills. And then for those people who want to, for me to evaluate them, then I'm happy to do that. And I would ask people, they would, you know, submit a unit of materials for their particular target audience, and then for me to give individual feedback on that. And so that's the nuts and bolts of it. But if anybody's interested, obviously they can get they can get in contact. I can send them a brochure, we can have a chat. I'm very happy to do that.
I'll put the, I mean, the link is there, I think, somewhere in the on this event, if you like, but I'll make sure that the link's somewhere obvious. And I will be writing a newsletter kind of around this topic, so I'll pop it in there as well. If you're not signed up to my newsletter yet, do that. So to kind of round things up, can you tell us anything about sort of what the future looks like going forward in terms of clinical communication skills? Because, you know, we're seeing very rapid change at the moment, aren't we, with things like AI, for example, or you know. So what are your thoughts about that?
Well, I mean, I'm sure that, you know, sort of some family doctors, GPs are sort of, you know, fretting a little bit about that, as we are as teachers. You know, is some machine going to go in and, you know, and sort of stop talking to my patients instead of me? But I don't think, you know, just as the same for us as teachers, you're never going to replicate that human element, which is so vital in the field of medicine. This is a very therapeutic benefit to just, you know, sort of chatting with your GP or chatting with your, you know, with the practice nurse, and that isn't going to be replaced. Obviously, it's going to have much more sort of effect in terms of, you know, AI. I mean, in terms of the sort of technical side of things. Imaging, for example, is going to become much more highly developed, and I'm sure there's going to be lots of changes in terms of how procedures are carried out and things like that. But what is changing already is the training. I mean, I say there's no change, but there is, to a certain extent. in a lot of universities in the US particularly, and I think they do it in the UK as well, is that they use simulated patients to train clinical communication skills. So that they consist of actors who sometimes they even specialize in a particular condition or a particular illness, and they come in and they are, as it describes, standardized. So for every student that meets these people as patients, they have to give the same responses, etc. And they're used in clinical communications training and examinations. Now, where AI is already coming into play is that all this can, a lot of this can be done virtually. So, that will change. But for us as teachers, we will still need to be training the clinical communication skills and ensuring that those healthcare professionals are able to give that patient a voice effectively in English. I mean, I don't think that we're going to go anywhere soon. We're still going to be here. That's what I'm saying.
Yeah. No. Well, I mean, obviously, I don't know much about it in terms of the medical side of things, but I think the quality of what's being produced at the moment, anyway, by AI is when you're talking about things like soft skills, and we're nowhere near yet, anyway.
No, it's the nuances at the end of the day, and I think it's the subtlety of language, and obviously ever changing as well. We can't replicate that for the moment. So for the moment, at least in my generation, I don't know if some of the younger people in the audience, it might change completely. Who knows? But for the moment, we're safe in our jobs, I think.
Thank you. So I did say a little earlier, if you have any questions or any comments that you'd like to make, please do. You can just about squeak one in before we wrap up, if you have any. If you're watching later on catch up, which I think probably a lot of people will, if you do add any questions or comments, Ros and I can come back and look at them later and still respond to them. So I'm not seeing anything coming up, but I'll give people a couple of seconds. But I really just wanted to say thank you very much, Ros, for coming and doing this live with me. Really interesting to hear a little bit more about it. Obviously, we've worked together, so I've heard some of this before, but I have learned a lot that I didn't already know today. So thank you for that. And it is a really fascinating area, I think.
Oh, it really is. And I think, and one of the things I didn't mention was that, the skills that you learn in clinical communications are transferable to other. Well, they're actually a lot of them are transferable into the professional world anyway. Active listening, empathy, reassurance, all of that stuff. But they're also transferable within the healthcare sector. So, my favorite thing is veterinary practice. And I did a few stints with a local veterinary practice where I just observed. And it's fascinating to see how people, the vets interact, obviously, with the owners. They have to be able to interact with the pets, otherwise that's but you're using the same kind of skills with the owners as you would with a patient. So it's absolutely transferable. The other thing that I'm going to be working on, I'm working on at the moment, is mental health. So mental health, and working something on mental health nurses, and that's sort of supersized soft skills. So that is going to demand quite a learning process. I thought that there would be a learning process with the vets, but actually not that big. But I think with mental health, I think there will be. I think there'll be a bit of a learning curve there.
Oh, but a learning curve's a good thing, I think, isn't it? It's nice to keep learning new stuff.
Keeps you on your toes.
Yeah, absolutely. Okay, yes. So Kat's saying Ros is emotionally intelligent, which could explain her expertise in this area. Absolutely, I would agree with that, without wanting to be like the doctors going, "You're intelligent."
You're intelligent.
But yes, I agree totally. I do think that is quite important, actually. I would have thought anyway, for teaching this kind of thing, that you'd have to have that kind of ability yourself to be able to teach it to somebody else.
Absolutely, but I mean, you know, I believe that most people in our industry are capable of that, and you know, and it's as I say, there's a lot of it, you know, that can be transferred into professional English in general. So you know, I think it's yeah.
Yeah, no, I agree.
I should just mention my newsletter if people are interested in. I am now offering a sort of a free monthly newsletter as well, which is great for me because it forces me, if you like, to do a bit more, sort of keep abreast with you know, with changes that are happening in clinical communications, but also to share a little bit of the knowledge and also provide people with a bit of free CPD as well.
Yeah. No, thank you for that. Again, the link is here in the event, and I'll make sure it's in my newsletter as well, which is a LinkedIn newsletter. So you can sign up for that on my profile, and then do join Ros's newsletter if you're interested in this area. So thank you very much, everybody, for attending and watching. And of course, thank you very much to Ros for spending some time chatting with us. And just remains for me to say goodbye and thank you.
Thank you, Rachel. Thanks, everybody. Bye.
Bye.